Heart attacks don't always strike out of the blue. In fact, your body might be whispering warnings up to a month before, but are you listening? Today we reveal 8 early signs that could mean your heart is in danger. Some may seem so harmless, you'd never guess they're connected to a heart attack. But missing them could cost you or someone you love everything. If you care about your heart health, subscribe now, like this video, comment if any signs sound familiar, and share this with family. You could save a life today. Lesson 1. Unusual fatigue. Have you been feeling more tired than usual lately, without a clear reason? You might be thinking, I'm just getting older. But when normal activities like cooking, walking to the mailbox, or folding laundry suddenly feel like a big effort, it's time to take a closer look. This kind of deep, dragging fatigue, especially if it's new or persistent, could be your heart waving a red flag. When the heart struggles to pump blood efficiently, your muscles and brain don't get the oxygen they need. The result? You feel wiped out, even after a full night's sleep. It's easy to write it off as aging or a side effect of medication. But if you notice that everyday things are wearing you out, or if you're resting more but still feel no better, don't ignore it. Fatigue that comes on suddenly, gets worse over days or weeks, or feels different from your usual tiredness is worth checking out. Your body often whispers before it shouts, and in many cases this kind of fatigue is one of the earliest signs of a heart problem. Pay attention. It's better to ask now than to regret it later. Lesson 2. Chest discomfort. We've all heard that chest pain is a classic sign of a heart attack, but did you know it doesn't always feel like pain? For many seniors, it's more like pressure, squeezing, or tightness. Some describe it as if something heavy is sitting on their chest. Others say it feels like indigestion or heartburn that won't go away. This discomfort might come and go. It may get worse when you move around or improve when you rest. But if it's happening more often, lasting longer than a few minutes, or feels different than usual, it's time to pay attention. Don't wait until it becomes unbearable. Seniors often dismiss early signs thinking it's gas or a pulled muscle. But your heart might be struggling long before a major event occurs. Women and older adults especially may not experience the dramatic crushing pain seen in movies. Instead, they may feel mild, nagging pressure or burning. If you notice a strange sensation in your chest that's hard to explain, trust your instincts. This is one signal your heart rarely sends without reason. If something feels off, don't hesitate. Your doctor would rather check now than face an emergency later. Lesson 3. Shortness of breath. Do you feel winded after light activities, struggling to catch your breath while talking, walking, or even resting? Many seniors notice this change and think, I'm just out of shape. But sudden or unexplained shortness of breath could be a critical early warning sign from your heart. Your heart and lungs work hand in hand. When your heart isn't pumping blood properly, oxygen doesn't circulate as it should. You may feel like you can't take a full breath, or that simple movements leave you breathless. That's not just aging. It could mean your heart is under stress. Shortness of breath often shows up weeks before a heart attack, especially in older adults. It may happen during the day or even wake you up at night gasping for air. Some people feel like they're suffocating or drowning. If you notice this kind of breathlessness, especially if it's new, worse than usual, or comes with chest discomfort or fatigue, it's time to speak to your doctor. Breathing shouldn't feel like a struggle. And when it does, your heart may be the reason. Don't ignore this vital signal. Taking action early can give you peace of mind and may save your life. Lesson 4. Pain in the arm, back, neck, or jaw. Not all heart warning signs come from your chest. In fact, many seniors, especially women, feel discomfort in places you might not expect. The arms, shoulders, back, neck, or jaw. It might feel like an ache, tightness, tingling, or pressure. And often, it's easy to brush off. People assume arm pain is from sleeping wrong or that jaw pain means a dental issue. But when the heart is in trouble, nerves can send pain signals throughout the upper body. This referred pain may be dull, nagging, or come and go. If the discomfort is new, unusual, or unexplained, and especially if it happens with exertion or stress, it could be your heart's way of asking for help. Women are more likely than men to experience heart-related pain in non-chest areas. And seniors often think it's a pulled muscle or arthritis. But don't guess. If you feel odd pain or pressure in your upper body, take it seriously. Even if it turns out to be nothing, getting checked gives you peace of mind. But if it is your heart, early detection can make all the difference. Trust your body's messages. They're there for a reason. Lesson 5. Nausea, indigestion, or stomach pain. Have you ever felt queasy, bloated, or had stomach pain that didn't seem connected to anything you ate? Many seniors are surprised to learn that these symptoms can be early signs of a heart attack, especially in women. It might feel like indigestion, a sour stomach, or even mild cramping. You might think, maybe I ate too fast, or that soup didn't agree with me. But when these digestive issues come out of nowhere and linger or return repeatedly, it may be your heart sending a warning. Why does this happen? The heart and stomach share nerve pathways. When the heart struggles, it can send mixed signals that feel like GI issues. Some people even vomit before a heart attack, mistaking it for a stomach bug. Seniors are especially vulnerable to misreading this sign. Medications, slow digestion, or diet changes often get the blame. But if your gut doesn't feel right, especially with other symptoms like chest discomfort, shortness of breath, or fatigue, get checked out. It might be something minor, but if your heart's involved, time is everything. Don't wait for pain in your chest. Sometimes the warning starts in your belly. Lesson 6. Dizziness or lightheadedness. Have you felt dizzy lately, like the room spins or your balance is off? Do you feel faint after standing or need to sit down more than usual? While occasional lightheadedness can happen with age, frequent or unexplained dizziness may signal a heart problem. Your brain relies on steady blood flow to stay alert and balanced. When the heart can't pump blood efficiently, oxygen drops and you feel woozy. It might feel like you're going to pass out or like your legs can't hold you. Seniors often chalk this up to medications or dehydration. But if dizziness is new, comes on suddenly, or occurs with chest discomfort, fatigue, or a racing heart, it could be your body's way of flashing a red light. Don't wait for a fall or accident to raise the alarm. If you feel off balance or have moments where the room sways, call your doctor. Your heart may be having trouble keeping up, and your body is trying to keep you upright and alert. The sooner you act, the better your chances of staying healthy, safe, and independent. Lesson 7. Cold sweats. Have you ever broken into a sudden sweat while sitting still? Felt clammy or chilled with no fever or activity? Cold sweats are often overlooked, but they can be one of the body's strongest heart warnings. When your heart is in distress, the nervous system reacts, triggering cold, damp skin, often with a feeling of dread or restlessness. It's your body's way of saying something's wrong. Seniors often blame this on anxiety, heat flashes, or medication side effects. But when you sweat for no clear reason, especially if it's paired with chest discomfort, nausea, dizziness, or fatigue, it may be a sign your heart is struggling. Cold sweats are especially important to notice at rest or at night. If you wake up soaked, shivering, or feeling off, don't just go back to sleep. These signs can show up days or even weeks before a heart attack. Trust your body. If you're sweating cold, feeling sick, and don't know why, don't wait. Get help. Early care can prevent a crisis and give you peace of mind. Lesson 8. Sleep disturbances. Waking up in the middle of the night, gasping for air, tossing and turning without explanation, night sweats. These could all be signs that your heart isn't resting, even when you are. Seniors often assume sleep trouble comes from aging, bathroom trips, or a poor mattress. But if sleep changes suddenly and you feel anxious, restless, or short of breath during the night, it may be more than just insomnia. A struggling heart can make it harder to breathe when lying down, triggering fluid buildup in the lungs. That can disturb your sleep, raise your heart rate, and leave you feeling more exhausted in the morning. If you've noticed that you can't sleep flat anymore, need extra pillows to feel comfortable, or wake up with a racing heart or strange dreams, don't ignore it. Good sleep supports a healthy heart, but a weak heart disrupts sleep. It's a two-way street, and seniors are more likely to overlook this sign or blame it on age. Listen to your nights. They may be trying to warn you about your days. Lesson 9. Swelling in legs, ankles, or feet. Do your shoes feel tighter than usual? Are your socks leaving deep marks on your ankles? This swelling, known as edema, is common in seniors, but when it becomes frequent or severe, it could be a sign your heart isn't pumping efficiently. When the heart weakens, blood doesn't move through the body as it should. This causes fluid to back up, especially in the legs, ankles, and feet. It may feel like heaviness, puffiness, or tightness. Sometimes, your skin even feels stretched. Many seniors blame swelling on salt, heat, or just getting older. And while those can play a role, persistent or worsening swelling should never be ignored, especially if it's accompanied by fatigue, shortness of breath, or weight gain. Some people notice they're gaining weight quickly, 3 to 5 pounds in just a few days. That's not fat, it's fluid, and it's your heart's way of waving a flag. Check your ankles each evening. Look for changes. And if you see something new or strange, call your doctor. Your legs might be telling you what your heart can't say out loud yet. Conclusion. If even one lesson in this video helped you understand your heart a little better, please don't keep it to yourself. Share your thoughts in the comments. Have you experienced any of these signs? Did something here surprise you or hit close to home? Your story could help someone else recognize the warning signs before it's too late. We read every comment, and your voice matters. Please like, subscribe, and share this with someone you love. And don't forget, your feedback helps us make videos that truly support your health. So go ahead, tell us what stood out to you most.